Hi, my name is Rosemary Gillum. I'm a biological sciences major, and this poster titled Chronic Low Back Pain Among Adults with Transtibial versus Transfemoral Amputation was an effort by myself, Sam Stauffer, Mayank Seth, John Horn, and Dr. Megan Science. Low back pain is 4 times as prevalent in individuals with lower limb loss compared to the general population. It is both debilitating and extremely complex. We have a tendency to blame it on changes in gait biomechanics, but if that's the main contributor, we would also expect to see worse outcomes in pain, function, and disability in persons with above knee limb loss compared to below knee limb loss. In this study, conducted by Delaware Limb Loss Studies and Independence Prosthetics Orthotics, we assessed differences in pain, function, and disability in those with above knee limb loss and below knee limb loss and chronic low back pain to see if outcomes were worse in people with higher level of amputation. We recruited adults with unilateral lower limb amputation who wore a prosthesis at least 4 hours a day. Their chronic low back pain had to meet the NIH definition of chronic, which is pain that has persisted for more than 3 months and for at least half the days in the last 6 months. To collect data, we sent out packets of questionnaires to participants. These questionnaires included the NIH minimal data set for chronic low back pain, the patient-reported outcomes measurement information system, or PROMIS-29, the modified Oswestry Disability Index, and prosthetic limb user survey of mobility, or PLUS-M. Table 1 reports demographic information. There was no significant difference in demographics except for weight, and no significant difference in severity of low back pain as assessed by the numeric pain rating scale. Figure 1 shows the modified Oswestry Disability Index. It evaluates back pain-related disability on a scale of 0 to 100%, with higher scores indicating greater disability. As you can see, both groups reported a moderate level of disability. The PROMIS-29, as shown in Figure 2, evaluates participants on various self-report measures from physical function to ability to participate in various social roles and activities. Higher values indicate more of that construct. There is no significant difference between the groups on any of the subscales. Finally, the PLUS-M in Figure 3 tested prosthesis-enabled mobility across a wide range of situations, from short distances in the home to hiking 2 miles on uneven terrain. Higher scores indicate better mobility. Again, the results were very similar across the 2 groups. Ultimately, our study did not find level of amputation to be a significant factor to patient outcomes regarding mobility, pain, and mental and physical health. This was very surprising, as we had expected that patients with above knee amputation would have remarkably worse outcomes due to the greater extent of their amputation. Therefore, when subgrouping patients with lower limb loss and chronic low back pain, factors besides level of amputation should be considered. Other literature has suggested that psychological factors such as pain coping skills, anxiety, and depression may have a stronger impact on patient outcomes than pain severity in chronic low back pain. Further research is needed to determine if these findings can apply to those with lower limb loss.